Hi, my name is Gracie, and I chose this topic because I think as a society we are increasing in our overall awareness of mental health. So I believe that it's important to just look at how we perceive ourselves and how that can affect our overall well being and mental health. I want you to think about yourself. What comes to mind? Are you viewing yourself in a positive or negative light? How one perceives oneself often has many effects, specifically with self image, body appearance, and how you treat or speak to yourself. And these perceptions can both be positive or negative. Our perception of ourselves can be influenced by many things: income, education, age. All of these play a factor in self perception. Achievement also is another factor in how much self esteem you may have, as well as just the changing role society has, specifically on beauty standards for women. All these factors can affect. There are a lot of things that you can place your self-worth in, but regardless, it is how you perceive yourself that affects overall well-being. So, which thoughts are you listening to? The perception of attractiveness is often influenced by societal standards, and this in return affects self-image. Not only with attractiveness, for example, how pretty one may be, but also body weight and overall appearance in general. Self-worth has often been linked to appearance concerns, specifically with weight and attractiveness. Staking self-worth in one's body weight can be detrimental. With women, the ideal body type has changed throughout history so many times, and women more than men link self-worth to their body image, and men have reported higher rates of self-acceptance. Finding support that those with poor body image, thinking you may be too fat or too thin, has proven to be associated with poor mental well-being. Associating the self-worth with body weight has been linked to anxiety, depression, and decreased life satisfaction. Having a negative weight bias negatively impacts overall mental and physical health, which leads to outcomes such as low self-esteem, decreased mood, as well as overall body dissatisfaction, less exercise, and unhealthy eating behaviors. It's important to recognize that societal influences play a large role in the internalization of perception of the body and body-related shame and dissatisfaction. Weight bias and obesity stigma is one of the few remaining acceptable forms of discrimination, and this has affected self-perception. Therefore, placing self-worth in your looks is harmful to how you view your appearance. Your mindset and thoughts have power and a direct tie to how you feel and act. But your perception of weight bias isn't the only thing that affects the self and self-perception. How you speak to yourself also matters. That self-talk has to come from somewhere, and it comes from what you believe to be true. Having higher levels of self-compassion correlates with higher self-esteem and self-worth stability. Therefore, positive self-view is a mediator for eudaimonic well-being, which simply means that positive self-view is needed for happiness. Lower self-esteem is correlated with depression, anxiety, and anger. Therefore, positive self-esteem involves some feelings of contentment and satisfaction with oneself. Self-esteem is separate from self-condemnation. Self-esteem refers to a global, positive, or negative attitude toward the self, while self-condemnation refers to blaming the self. Self-esteem is not the only factor that can affect overall well-being. The strongest predictor of anxiety and anger is levels of self-compassion. A predictor of depression and flourishing is self-acceptance and self-compassion as well. All of these factors interact together to allow us to reflect inwards and form either a healthy or not so healthy view of the self. Perception of self can be affected by family. If you invest your self-worth in family support, your self-esteem will be affected. And family dynamics shape attitudes toward appearance. Parent and child relationship is also linked to perceptions of the body. If there is a negative relationship, there will be more body dissatisfaction, lower self-esteem, and depression. Mindfulness affects personal growth, purpose in life, and self-acceptance. If you want to increase in positive self-view, it would be better to emphasize the non-judgmental aspect of mindfulness as opposed to reflection. The aspect of how you perceive yourself plays a role in self-image. So when you're looking at your inner self, that's also kind of known as mindfulness. Mindfulness is related to self-consciousness and self-awareness. Those who reflect more on their inner world are more mindful. Their self-esteem is better in the non-judgmental category compared to just reflection with judgment attached. So, to conclude, a controlled sense of self, meaning a more passive, non-judgmental view, shows a stronger relationship with positive self-view and overall self-consciousness. Being aware of your own perception of self-image can help you with how you treat yourself. Is society influencing your views of yourself? Are you taking a judging or non-judgmental view of the self? Is your self-worth linked to appearance? Thank you for watching my video. I hope you are able to understand how perception of self can affect things like viewing your appearance and overall self-esteem. It's important to be aware of your own thinking patterns in regards to self, just to make sure we have a healthy view and not one that is linked to judgment and criticism, because it can and has proven to have negative effects.